So Tracery is a clinical stage bioimaging and digital health company. We have 3 technologies, and our core technology is a functional imaging method. And supporting it, we are developing 2 software analytic programs, the first using non-cognitive computing and the second using cognitive. So we all know that age-related macular degeneration is a leading cause of irreversible blindness, and yet there's no treatments. So if we look at the reasons for that, the first is it is a complex disease, it's multigenic, it affects the immune system, innate immune system is altered, and plus there's a tremendous epigenetic component. Further, clinical trial design is difficult, and this is exemplified in this picture. So the image on the left shows a patient with a patch of geographic atrophy right in the middle, which means they can barely read the eye chart. The other patient has about the same amount of atrophy, but there's no loss in the center, which means they can read the eye chart very well. And this means measuring visual acuity is not a good endpoint. This is our third hurdle, is that we can't biopsy the eye. So basically, ophthalmology relies on imaging, and I'm going to just show you these 4 patients that we're going to talk about as we go on. So the patient on the left, you can see the yellow drusen, and you can also see that patch of atrophy in the middle. That second patient is the patient you saw a moment ago with the sparing the fovea. The third patient has early disease and no atrophy, and that 4th patient's really hard to figure out. So this is our gold standard imaging, which is fundus autofluorescence, and again, you can see that patch of black in the first 2 patients. The third patient does not have that patch of black, and the 4th patient has a little bit, and some other scattered abnormalities. So the question is, how does this kind of image help us with clinical trial design? And it boils down to something very obvious, and that is that we can actually measure what's black. It's very, very difficult to measure grayscale, but this is where non-cognitive computing or structured algorithms come into play. And because we can measure it, we can follow those patients over time, and we can watch those patches expand, which is the current phase 3 clinical trial endpoint. When you get to something like this, we enroll these patients in the dry AMD studies because they've got these complex hyperfluorescent patterns, but it's very, very difficult to quantify this. So what we've talked about so far is called structural imaging. And so, for instance, fundus autofluorescence allows us to stratify into early and late disease, but what it does not allow us to do, for instance, is identify patients for patch prevention assays, and nor can we quantify the burden of disease. So functional testing, people are working on microperimetry. Oops, did I just, uh-oh. Can we go back? Yeah, so there's functional testing. And so people are working on microperimetry, multifocal ERGs, dark adaptometry, but again, a lot of these require patients to be able to fixate or participate in the tests for extended durations. By contrast, functional imaging is based on the goal of capturing normal tissue physiology in a snapshot. And the corollary of that is that you should therefore be able to capture abnormal tissue, and that would give you a measure of the disease. So how would that help with clinical design? Well, for one thing, it might help us identify patients for patch prevention, for GA prevention studies, but it would also really help us enrich our clinical design by enrolling those with a higher burden of disease and excluding those with less. So there's our technologies, and instead of going through that slide, I'm actually just going to show you. So this is our patient with that large patch of fundus autofluorescence, and you can see around it a few smaller patches. So this is what we see with our imaging, and it's clear we're picking up disease above and beyond the dead tissue. And the neat thing about it is that these regions are black, which means we can quantify them. So here's that 4th patient, that complicated patient, and you can see those little scattered patches of geographic atrophy. This is what we see with our imaging, and we're picking up considerably greater burden of disease and comparing the gold standard to ours. When we put together pseudo-composites of the eye, so this is the fundus autofluorescence, you see the blood vessels and the optic nerve head and a couple of those small patches. This is what we see. So in addition to seeing more black, we've discovered over the last 2 years of doing this imaging now in over 100 patients, we've got thousands of pictures, that AMD actually extends beyond the macula, and that there are these complex patterns in the center and in the mid-periphery. Here's our patient with early dry AMD, no geographic atrophy, and this is what we found. This patient has significant dark black in the center, and again, the complicated pattern in the periphery. So there's the comparison, the gold standard to ours. This is their pseudo-composites, and you can pick up, it looks essentially normal. And here's what we're seeing. So much more disease and extending beyond the macula. So over the course of doing this, what we've discovered is we are seeing these patterns, unprecedented patterns. We don't even know what to call them. So we've been calling them loose weave and tight weave and fingerling potatoes and all sorts of things. And this is where you can no longer use non-cognitive computing. And so we've recently, and I can't say the name yet, but we're partnering now with a large artificial intelligence cognitive computing system that will help us analyze these images. So I want to go back to this notion of these hyperfluorescent patterns. So this is fundus autofluorescence of a patient and of one of our rats. And a lot of you know we have a drug development program, and our imaging program came out of our animal model. And in our animal model, unlike a patient where you can't biopsy the eye, we could take out the animal eye. And when we look at those bright patterns, we learned a couple of things. And one is that abnormal RPE contribute to that signal, but so do macrophages. And I couldn't stand up here without measuring our sister company, which is Translatum Medicus Inc. And we're a drug development company, and we are modulating macrophage behavior. And now we can see that they are located in the right place at the right time. And we're presently working with BTIG to raise money to get into clinical trial. So to summarize, there we go. So to summarize, Tracery is a clinical stage bioimaging and digital health company. We have a functional ophthalmic imaging platform and associated software analytical programs that ultimately I think will allow us to compare not only images, but to compare against all sorts of other patient data, including their genetics, concurrent disease, concurrent medications for personalized medicine. Thank you very much.